Welcome to Rare Aware New Zealand. I'm Alana Peck. This podcast is dedicated to raising awareness and sharing the voices of people living with rare disorders in New Zealand. Around 1 in 17 New Zealanders are affected by a rare condition. For many, finding answers and support can take years. Here we speak with individuals, families, and experts to help build greater understanding, connection, and support for the rare disorder community. Thank you for listening and being part of the Rare Aware journey. For more information on Rare Disorders New Zealand, you can visit us at www.raredisorders.org.nz. Today I'm speaking with Lisa Underwood in Auckland. Lisa, thanks for joining us on Rare Aware.
Thank you.
To start off, what's the story behind how you ended up working in health research in the rare disorder space?
Well, it's a bit of a long story. So I did my undergraduate degree in psychology back in the UK and realised I always wanted to do research. And I thought I wanted to do mental health research, but ended up getting a job in a psychiatry of disability department. I was a PA for a psychiatrist. And there I met a self-advocate, Wendy Perez, who was a wheelchair user. She has intellectual disability, and she was really involved in training doctors and about how they should interact with people with intellectual disability, and also research around improving access to services for people with intellectual disability. And she was a massive inspiration, got me interested in intellectual disability research. And so that was before my research career, really. So then I finally got onto my research career path. Wasn't in intellectual disability, but eventually I got a job looking at mental health of people with intellectual disability. That led to my PhD, which was around adults with autism and intellectual disability. And that led to a job where I was working for the TS 2000 study, which is a study that was set up in 2000 to follow up children with Tuberous Sclerosis Complex. And I was going back to visit them 10 years after the study had first started to find out how they were going, what was happening in their lives. And then it just progressed from there. When I came to New Zealand, I got in touch with Helen and Janet, who were just starting TSC New Zealand. They'd just kind of started up as a separate branch from TS Australia. And then so I had a coffee with them. Before I knew it, I was on the committee. So that was about 11 years ago. And since then, I've wanted to kind of go back to combining my research work with the community work that I do for TSC and for rare disorders. And I've just started doing that in the last year. So I've kind of come full circle.
Brilliant. Sounds like that first interaction with Wendy.
Yeah.
Is what started you off
It
on
was.
A great course. And those coffees do tend to end up leading us to joining communities, don't they?
Yeah, they do. And I guess one of the things that was why I got in touch with them when I arrived here from the UK was the experiences I had when I was working on TS 2000. So I was visiting families all around the UK and a couple in Ireland, and spending pretty much all day with them. I would be spending a time with the young person with TSC, doing all sorts of assessments. My colleagues would be interviewing the parents, and those families were so welcoming and kind, and so happy to give up their time for our research project. It was really inspiring, and it was a really amazing experience. So without really knowing what I was getting into, I thought, I wonder if anybody's doing any TSC research, and I wonder what's happening. So that's how I ended up on the committee for TSCMZ.
Yes. So you've been there for 11
years? 11 years. Yeah. And then this year I've just taken on the role of community organiser. So previously Helen was doing that role. She's also our president, and that was quite a lot of work. So for that role, it's mainly sort of updating the website, um, answering emails, kind of keeping an eye on whether people would like any materials. And then next year, we're planning to have one of our family conferences. So that'll be in October 2026. So that's going to take up a big part of my time.
A lot of organising.
Yeah.
And logistics are now a little bit very spread out country.
Yes.
When it comes to rare disorders.
Yeah. And we've had, so I think I just missed the first conference, but in the last 11 years, we've had one conference in Wellington and one in Auckland, so we definitely need to cover.
Take it south.
The South Island, yeah.
Some good people live down south.
Yeah.
So all your work that you've done with TSC has led you into the Rare Disorders New Zealand Research Network. Can you tell me a little bit about that?
I think I've always thought in the back of my mind that I want to continue. At the time, I thought I would just continue doing TSC research. So I should probably explain the kind of research I do.
That'd be great.
So I do kind of quantitative social science research. So it's data and numbers. It's usually about people or groups of people kind of at the population level. So it's not, I'm not in the lab. I don't wear a white coat. I'm interested in, I guess, the impacts that having different health conditions or living in different circumstances have on people's long-term outcomes, by which we mean, their health, their well-being, their employment, their education. So we know that these are challenges for people with a whole range of different health conditions. But obviously, from visiting those families in the UK, I was really aware of the breadth of difficulties that people with TSC and other rare disorders have, and the impact that has not just on them, but on their families as well. So that's another area I'm really interested in, is impact of different health conditions or of health conditions in general, or not just individuals, but on their whānau, on their kind of wider community.
Yeah, it does really affect the whole community. It affects all the children. Just on the weekend, I was in Australia at a conference and listened to a sibling's perspective. Wow, there was not dry eye in the room, and it really brought home, as a parent of 2 children with rare disorders, around the siblings and the wider community, the aunties, the uncles, the families, everybody, not just mum and dad and the person living with the rare disorder, but that wider community of how it affects everyone. And that's awesome that you are researching all of that.
Yeah.
And hopefully in the future, a lot of that can shape how social systems support our families with rare disorders.
I really hope so. I mean, for me, often the best way, if you want to know how people are impacted by a rare disorder, is you talk to them, you ask them. But that's not always, I guess, taken into consideration when people are making decisions around policy and practice. Yeah. So I guess it's my job to find some of the data that supports that. So we can actually say, look, there's this number of people in New Zealand that have this particular rare disorder, and maybe not as a result, but living with that rare disorder has impacted, their ability to do X, Y, and Z. So I think that's how I see my job, is providing evidence that is going to support what groups like Rare Disorders New Zealand want to do. Because as a researcher, I have limited power, I guess, to make changes. And, academics often publish their work in journal articles and go to conferences, which reaches other academics. But I'm getting more and more kind of interested in the idea, or involved with providing that information and evidence to grassroots support groups and community groups, because they're the people that have more know-how about how to engage. We've seen the amazing stuff Rare Disorders New Zealand has done in the last year that researchers, I don't think, would have been able to do. So
it's been a big year for Rare Disorders New Zealand.
It really has, and it's amazing. And I want to be able to, do what I can with my skills to further that.
Thank you.
Where possible.
Thank you for being so interested on that side of the research, because it is really valuable for decisions and for charities and groups like Rare Disorders New Zealand to support people in New Zealand. Can you tell me a bit more about TSC?
I can. So Tuberous Sclerosis Complex is a rare genetic disorder. So it affects around 1 in 6,000 births. It affects 2 genes, TSC1 and TSC2. It causes benign tumours or tubers, which is where the tuberous comes from. It causes these benign tumours to grow in many organs in the body. Where that seems to have most impact is when those tumours grow in the brain.
Yes.
So around 90% of people with TSC have epilepsy or have seizures, and probably because of that kind of activity in the brain, that has a bit of a cascade effect. So around 50% of people with TSC also have an intellectual disability and or autism, ADHD, and many people also have difficulties later life where they might get tumours in their kidneys. And that, to be honest, it pretty much affects every organ in the body one way or another.
Wow.
But at different stages of lives and different for men and women. We call it variability, but the impact on people who have TSC is vast. So there are people who go their whole lives without realising they have TSC because they don't have any symptoms and they actually never have any problems. And then there are people who are really, very severely affected, who have multiple and profound disabilities. And to some extent, it's impossible to predict, where on that spectrum somebody will be once as they develop. So one thing that's really good at the moment or now is that TSC is more often diagnosed during pregnancy than it used to be. So that's done by detecting, informed about TSC, and they can know what to look out for in terms of.
They can start with their guidebook.
Yes, yeah. So one of the key kind of early issues with TSC is when children have infantile spasms. And these are really hard to recognise. Most people don't realise what they are. There's a lack of awareness in general, but also among, clinicians and midwives about what infantile spasms are. So quite often people don't, realise that's what's happening, and then that's having a kind of escalating impact as time goes on and a baby has more of those spasms. So that's one thing we would love there to be more of, is awareness. Of people of what an infantile spasm looks like. It's very subtle, but people do realise in hindsight, I always thought there was something,
not quite right,
not as it should be.
So can people find out more about TSC from your website?
Okay.
And is there information around for those early years of if someone suspects infantile spasms?
Yeah, so our website, I hope, is up to date. We've got, general information about TSC, what it is, but we've also put together, mainly with support from the Australian organisation, TS Australia, we've got specific resources that we've adapted for New Zealand. So we've got what we call parachute packs. So it's a pack of information for families that they can look at themselves and they can talk to their doctors. So we've got one for when it's thought that a baby might have TSC during pregnancy, and then we've got a parachute pack for newly diagnosed children, so where it hasn't been recognised until a bit later, and for adults as well. What we quite often see, which is common in quite a few conditions, I think, is that it's often not until a child has a diagnosis that a parent then realises that they get tested and they realise they also have TSC. That's a pretty common thing to happen because they've been very mildly affected, haven't realised, but then they've had a child who's more severely affected, they've been tested. So there are genetic tests, obviously, to determine whether someone has TS. It's not a requirement, so that you don't have to have genetic testing to get a diagnosis. But it helps for families to have an understanding of whether there's TSC in the family. And I'm going to struggle with my statistics. I think around 30% of people with TSC have a parent or another family member with TSC, and the other 70% it's a spontaneous variation in the genes, so it's not in the family. But it's important for everyone to get that genetic test just to see, so they can make decisions about having a family. And
100%, and then especially in 2025, having that choice of carrying on those genes as well and what we can do with it. That's really great. I love the parachute pack. That it just sits so close to home for me. Of you get a diagnosis and you feel like you're falling out of a plane with no parachute on. So that well done.
So yeah, we've got those and information packs for clinics, specifically for clinicians. So they're all on our website that people can download, but we also have hard copies. So if people email us, our email address is info@tsc.org.nz. We'll send them out in the post, or we'll send them to schools or doctors, whoever needs to know that information.
That's brilliant. And from your connection with TSC families, what are the challenges you hear about the most?
For a lot of people, because TSC affects so many different parts of the body, it's that navigating through all the different, not just health services. So people with TSC might have primarily contact with a neurologist, but epilepsy, but they're also likely to have contact or need appointments with a nephrologist for kidneys, dermatologist, psychologists, a whole raft of health specialists. But then also there's issues, around getting access to services for school. So that, we often hear that just having a diagnosis of TSC is not enough for people to get access to education services. So people will have to go through that whole process of getting a diagnosis for autism, ADHD, intellectual disability, which we know isn't easy. There's finding a good GP. We know that's something that people struggle with. And it's quite overwhelming for people, the sheer number of things they're juggling just around appointments, letters, and what seems to be lacking is often those people aren't talking to each other. So it's down to often families. If we're talking about young children, it'll be up to their parents to coordinate everything and inform the individual specialists of what's going on with the other kind of areas that they're struggling with. And that's a massive responsibility and job, really. It's a lot for people to take on.
That's where coordinated care would be fantastic for it, wouldn't it?
It would. In the UK, they have specific TSC clinics. in all the major cities, they've got a TSC clinic. They've usually got psychiatrists lead those, or they did it when I was there. And they're specialists in, so they're generally intellectual disability psychiatrists, and they specialize in TSC. They understand TSC, and that's within the clinic. The clinic coordinates those appointments, make sure that there are multidisciplinary multidisciplinary coordination. So the clinicians might not actually all get together, but they're communicating with each other, which is the main thing. And
does that mean the parents get to be parents?
To some extent,
and pass some of
that
a little bit responsibility.
There's a little bit of that. I think it just it takes a bit of a weight off, and knowing that those people are specialists in TSC. Of course, the trouble is in New Zealand we have fewer people. Yeah. So in the UK that works because there might be, trying to think how many people there might be with TSC, but it might be, within a broad catchment area, tens of people or 100 people with TSC. In New Zealand, that's going to be there's going to be fewer people, and we're quite widespread geographically. So what we need is to find a way to overcome that. We can't just say, well, it's not going to work because it's not enough people to do that. We need to either team up together with other rare conditions to get some centres of excellence for clinical services that understand some of the common barriers to services for people with rare disorders. We need to find a way. We've got technology now that we can use,
yes,
to help people get together in a room when they can't be together geographically. They can be together virtually, and it's having some of the, I guess, electronic systems that the health services use adding up and having that information shared.
Definitely. And I feel like sometimes for me, I live an hour and a half from our hospital, and sometimes I might have to go there 3 times in 1 week because there's no coordination between those appointments. And for me, it's okay, I can do that. I'm home with my child full time. But for other families that have to take time off work, it just puts so much more stress on the system of the already stressful household system. It would be really good if we could coordinate that care a lot more to streamline. And I can imagine it would save a lot of money.
I think so. I mean, things like having an MRI. So people with TSC should have regular MRIs, particularly of their kidneys, to monitor whether there are any tumours growing. And sometimes they might it's really hard to get access to an MRI in the first place, but there seems to be a disconnect where they could go to have one scanning session and get a whole load of things covered off instead of having to be on 3 different waiting lists and have 3 different appointments to scan different parts of the body.
And what usually comes with people with rare disorders is that one, pre-verbal trauma from when they're a child and they have all these interventions done, and then I can only imagine what it would be like for someone who's scared of an MRI machine having to go through 3 MRIs when if it was coordinated properly they could have had 1.
Yeah, it's a massive thing to go through for especially for people who aren't able to understand what's happening to them. I've never had one, but I understand it's quite intense. I'm quite keen to have one. I'd love to see my brain.
I can imagine your brain being very busy and so full of knowledge, like a bit like these pictures here where there's just so much life and colour, and that's how I see you, like just so much happiness, and just, I know people can't see you right now, but you are glowing talking about this, and that's really important that you, for your research to come across and target people that need to know what we need in New Zealand for rare disorders, is someone like you that's so passionate about it. But MRIs are uncomfortable.
I think, I couldn't do the work. I couldn't be motivated, couldn't have the level of motivation I have for my work without that kind of passion, I guess. Like, I struggle with motivation quite a lot. So I kind of need that, not urgency, but that feeling that, like, I want to do something, or I'm pretty geeky about the data, so often it's just I want to know what the patterns in the kind of people's lives are, but I need that extra motivation of, like, having that contact with community groups. So when I was doing my PhD, I was out in the community meeting families, adults with intellectual disability and autism. I collected, I think it was about 130 people I collected data from. And then I did a year in Brixton Prison collecting data there. When I came to New Zealand, I started working on this more population-based research. So I was working for the Growing Up in New Zealand study. And for that research, it's what we call secondary data. So you're not out there collecting the data. Someone else goes out there, does all the interviews, collects the data, and I just see the numbers. And it's really hard to get a real understanding of what that data means if you don't have some connection to the people or the communities that data is about. So I think that's partly why I like to work alongside community groups, because it gives me that motivation and connection to what things are like in the real world, not just on my computer screen represented by numbers.
The people are people, not just numbers.
Yes, exactly. And you can identify all sorts of patterns, and you can think, oh, this is awful that this is happening to people, but you don't really understand the reasons for some of those disadvantages that people have, or how that impacts them as a whole or their families, until you're actually talking to people about it.
So what research are you working on at the moment, if you can share?
I can. So I'm working part-time at the moment at the University of Auckland. So I'm a senior research fellow. So I'm not teaching at the moment, just doing research. And a couple of year and a half ago, I applied for funding to specifically look at rare disorders in New Zealand. So I have access to something called the Integrated Data Infrastructure, the IDI. So this is all government data. It's things like data from the census, which is really valuable, but also administrative data, which is data that's kind of collected about us as we go through our lives, interacting with different services. So when we're admitted to hospital, form is, data is entered about who we are, why we're in hospital, how long we've stayed in hospital. And you can imagine, actually, as we go through life interacting with a range of different services, so health services, education, justice, Ministry of Social Development, as we pay taxes, all that data is collected. It's completely anonymised, and it's made available to researchers like me in a special computer lab that's just upstairs here, that you have to be trained in how to use. It's a locked down lab, so you can't, only researchers with official approval can go in there. Anyway, I was doing a lot of this research. I was looking at the impact of kind of more common chronic conditions on family members, and I got to thinking, we could look at whether we can find information about people who have rare disorders, and it would give us more information than we currently have on more people that we're able to reach through other methods. Because as you know, when you do surveys, it can be really hard to get to collect data, and you're not likely to get data from a necessarily representative group that is broad, represents the broader population. So I decided to develop a project to really just look at who are people in New Zealand who have rare disorders. I'm not going to be able to get information on everybody with a rare disorder, but we can get some information on a pretty big group of people who've been diagnosed with a rare disorder, and we can follow their journey through the health system, but also through education, through work. At some point, hopefully, we can also look at their family members. So I put together a grant application. I got in touch with Kim and Chris. Well, I don't think it was Chris at the time. It was before Chris's time, but I got in touch with Rare Disorders New Zealand and said, I would like to do this research. Are you interested? And of course they said yes. And yeah, I was really fortunate to get funding from Ember Innovations. So they run lived experience grant or fund for people who've got experience of mental health services or mental health difficulties. So I was able to get funding through that scheme, because that pretty much funds research on anything. So it's kind of given to the person who can then go on, and so that was quite a unique position to be in. Normally I would be targeting my proposal at Health Research Council, or and it's quite difficult to get funding for rare disorders from the usual channel. So for me, getting this lived experience grant was enable me to do the research that I want to do.
Again, thank you. Thank you for doing all that background work to help us keep advocating for people with rare disorders in New Zealand. And it's really interesting. I would really love to see the health side of it, but also the education and where people end up in the future, because we do know that people that have struggled with health when they're younger and schooling, it does follow them right through life if they don't have the right support.
I'm not sure how much scope I'm going to have to look at that for this project, but I'm really keen to look at things like attendance. Are children being kind of marked as having unapproved absences when actually they've got health appointments, or a sibling has health appointments? There's reasons why they can't get to school. That's one thing we have really good data on, is attendance,
especially now.
But and again, it's only through talking to families and parents and them saying things like, there's this crackdown on absenteeism among children, but my child quite often can't get to school because of X, Y, and Z. And, people are made to feel bad that their children aren't attending school, and there's very good reason, not always well understood reasons by schools and by the health professionals. So that's when I get these like little sparks when someone mentions something, and I think, I could get data on that.
I hear you. I've got 4 children and 2 are at Southern Health School, purely because mainstream school doesn't fit their health requirements.
Yeah.
And it is hard when you get those constant text messages and you're lying in hospital and you're like, I've told the school, but it obviously hasn't reached the right person.
Yeah.
And you do feel like, well, for myself personally, I feel like I've let my children down because they're not at school, but physically they can't get there. So that's where things like Southern Health School, Northern Health School, Central Health School really can come in and help out on those kinds of things, because there's so much guilt put on us as parents. And it's not like that's the path we've chosen to take with our children, or it's been put on us to have that path of living with a rare disorder. And if simple things like schooling can be made easier, and then your coordinated care could be made easier, and then wonderful researchers like you are backing us parents saying this is what we need for a better New Zealand, that's amazing. Well, I've learned so much so far about your research, and that leads me to my next question with you is, What makes researching rare disorders tricky in New Zealand? And are there things that surprised you once you started digging into the data?
So it's mainly difficult for, I guess, two reasons. One is that we know people with rare disorders often go undiagnosed for a very long time, and the data I look at relies on a very specific coding system, and people being given a diagnosis of a condition using that coding systems. And we know there are people who struggle for years to get a specific diagnosis. And it's hard for me as a researcher to get any information on those people because they don't have that diagnostic code. The other thing is the diagnostic code we use in New Zealand currently, which is the International Classification of Diseases, the ICD. It's quite a restricted number of codes. So actually, there are some codes that include hundreds of rare disorders. So the disorders have a name,
Yes.
and we might know a lot about their kind of genetic origin or other things about them, but they're grouped in with a lot of other disorders when they're coded in our health system. That is due to change. The government, the health department is due to implement using a different coding system called SNOMED, which should make a massive difference. But the data I have to work with is not there yet. So that's been the hardest thing, is trying to figure out what conditions are rare. And actually, that can change over time.
Especially like different places in the world as well.
Yeah, and different. So some conditions might well have been very, very, very rare in New Zealand in the past because we had a very different socio-demographic makeup in terms of ethnicity and people coming from overseas. As that's changed over time, there are some conditions that might affect people from a Middle Eastern background that we wouldn't have seen in New Zealand 50 years ago, but we have people in New Zealand now with those conditions. So it can be hard to keep track. That's not my job, luckily. So that's two things. I guess the other thing is that assumption that rare diseases or rare disorders are too rare to study. So not thinking about them as a collection of disorders, being able to get funding from a funding body that recognises the importance of the research and that recognises that grouping together a collective of rare disorders is valuable, is worthwhile because it gives us a lot of information. That's where funding is always the issue for researchers. So persuading funders that we can find enough information on enough people, and that group of people, or grouping those people together, can give us relevant information. That's probably been the hardest things. And I'm hoping that my research project will move us a little bit closer to persuading the funders for the kind of research I do, that we need to know more about the impacts of rare disorders in New Zealand, not just on people who have a rare disorder, but their families and the health system, disability system, education systems.
All the systems.
Yes.
So leads into my next question around how important is the relationship between researchers and community groups like TSCNZ or Rare Disorders New Zealand?
I think I touched on that. For me personally, it's about that understanding the real world implications of what I'm doing and getting that motivation. For me, some of the key things are knowing, I guess it's about knowing what questions to ask. So academics and researchers always start with a research question. We can review the literature and see what the gaps are according to the literature, but really the best way to find out what we need to know is to ask people who live with a condition or who work with people with conditions to say what needs to change is the first question we should be asking. What needs to change? What can we do to help that change? Or what evidence can we provide or try to provide that can move things forward? And yeah, if I tried to come up with all of the research questions myself, they'd probably be a little bit boring because of my slightly geeky data brain. They'd be very detailed, but they might be just not that interesting or useful.
So it's fitting the research around the outcome that you want
to
have.
Yeah, pretty much. I mean, it's got to be, if we don't, if what we're doing isn't useful or valuable to communities, then there's no point in doing it, really.
Which makes funding harder next time, doesn't it?
Well, the problem is that funding bodies want research to be valuable to saving money and the health system, and persuading, or not persuading, but unfortunately for funding bodies, what the community actually wants is not always their priority. Their priority is finding ways to save money at the moment, anyway. So that's that's the tension I think we have as community groups. We want to do so much for our communities, but the lack of funding is a significant issue. So I think part of that is that researchers and community groups are somewhat in the same boat. we all want to change things, but no one will give us any money to do it. So we need to work together.
Yeah, just collaborate on things, isn't it?
Yeah, and for me, I don't have the contacts or the ability to connect with policymakers and advocate in the way that Rare Disorders New Zealand does. So Rare Disorders New Zealand can do all the amazing work it's done advocating that it's beyond my capability and my job, I guess.
But they always have your data in their back pocket for you.
So I just want to be able to feed into that.
That's brilliant.
And yeah, as researchers, we've got access to resources through, I've got access to resources through the University of Auckland that researchers don't. Community groups don't. I've got the skills to analyse data, present data. So it's about just pooling all of those skills and resources that we each have to hopefully work together. I mean, it makes sense instead of working separately.
Sure it does, doesn't it? So what would be, if you had a chance to sit down with decision makers, what would be one thing you would love to change for people with TSC and other rare conditions?
I mean, the main thing would be recognition, that there's a recognition that although individually rare disorders are rare, collectively there's a lot of people affected as individuals and a lot of families affected, and that even though rare disorders can be very different from one another in terms of how they begin, where they come from, how they affect people, we see these common things or common difficulties for people in terms of coordination of care, navigating those health systems, having general, general practitioners and teachers and non-specialists having an awareness. So I guess it would be about not just, it's obviously raising awareness isn't enough. It would be about acknowledging that something needs to change.
Yeah.
Well, that things are not going as they should be. Exactly. And the rare disorder strategy is a huge step forward for that. I know it hasn't been an easy path. But the health service has, programs and guidelines for specific chronic conditions, diabetes. They have specific pathways and work programs for cancer, and we need some of those for rare disorders. We need something that acknowledges that.
It's a huge amount of people.
It is.
Estimate around
Exactly.
300,000 people living in New Zealand. That's the size of Christchurch plus.
Exactly.
It's a lot.
It's not enough to say, well, it's not enough people, and they're too diverse in there. But so people experience cancer. Cancer is a very wide condition. Affects people in very, very different ways. Obviously, it's not a competition. We're not trying to outdo any other condition, but it's recognising that this grouping is clinically relevant and socially relevant, and can be, I guess, grouping people together, grouping conditions together in this way can be used to make changes.
And hopefully teach people in the future when they're making decisions around like newborn screening, for instance, is knowing that early intervention can make a huge difference with schooling, with health systems, with social systems, with family systems, with making choices in the future of where you live in New Zealand and what care you can access. Do you need to, unfortunately, move to Australia for better care because the condition is so rare, or where you live, we live rurally and we're limited to one hospital in the South Island. If we lived in Auckland, we could have accessed several cleft teams and it would have changed our son's journey through schooling and everything. So I think it's really important when you have that choice to make of where you live in the country. And I don't think that should be a barrier for us where we live and accessing the care that we are entitled and deserve to have.
And that's a really common issue for a lot of people who need access to things like neurology services, MRI scans, not just people with rare disorders, conditions where you need to visit a specific clinic to get your treatment or your medication. It's so much harder for people who live rurally or who live outside of the main centres
and don't have support of people being able to take them to those appointments.
And to some extent, that's the infrastructure. It might not be possible to change some of that infrastructure, but perhaps if we improve some of the coordination and get clinicians from different parts of the country talking to each other, we can make it easier so that people don't have all of that to deal with.
Where were you 20 years ago? This is really exciting for the future, and that is why I feel so proud to be part of the rare disorders community and the change that we are making. And from 6 years ago, coming into rare disorders to where we are now, it's huge changes. What would be something that you would for young researchers listening, what would you say to encourage them into this field?
I think, just everything I've talked about, just for me, it's the people that are generally lovely and engaging and interested, as interested in the research as I am, which I love. I think, there's so many different areas of research that could focus on rare. So we're just about to organise. I've got to plug this. We're about to organise our community session. So the research group centre I work for, Compass, has a community session every year. It'll be the third one in March next year, 2026, and it will be a focus on rare. So I was putting together some of the talks that we'll have, so from researchers, and there's going to be population researchers like me. There'll be people who are researching the genetics of rare disorders, people who are running surveys for people with rare disorders, people who are compiling registries, there was one other as well. So there's so many different types of research. So people often think when you say you're doing rare disorder research that you are in the white coat, but there is that area, but there's a lot of other areas of research that people can get involved with. Often it is you find it that people have a personal connection to rare disorders or to other health conditions. So, I mean, my advice to anybody who's interested in research, which I think everybody should be.
I'm interested now.
Who would like to, be a researcher or is a clinician and wants to do research. If you have, if rare disorders is something that interests you and might inspire you, just have a look at the university, do a Google search for rare disorders researchers, see who pops up. There'll be several different people and within the Rare Disorders New Zealand Research Network. Now I should know how many people are in that. It's like it's many. It's a good
a lot.
Yeah. And get in touch with those researchers and say, what you're doing. Can I help? We love students who are passionate about what we're doing. So if a student from another university or an undergraduate contacts me and said, I'd like to do a PhD or I'd like to do a master's or I'd like to do my honours project, pretty much any project, and I'd like it to be around this, I'm always happy to have a chat to them. Yeah. But if I can supervise them myself or point them in the direction for someone. As academics, we love having students that really are interested in the things we're interested in. It's a great way for us to get work done because, if they've got scholarship or if we can get funding for them for a scholarship, it makes things a lot easier. And, it's good to have those early researchers coming through and eventually, they'll become mid-career researchers and eventually they'll be the professors. And yeah, I think the research network community, I guess, in New Zealand is very friendly and always open to talking to people. That's what I love about being in New Zealand. It's that thing of you flick someone an email saying, oh, you seem to be interested in a similar thing to me. Before you know it, you're meeting up for a coffee and then you're
11 years later
you're involved somehow. It's the same thing. It's lovely that New Zealand works that way. That
it's really cool.
Meeting up for a coffee is the standard approach to anybody who says, "Oh, I'm kind of interested in this." It's very nice.
Yeah, so our family for maybe the past 5 years has worked with the rural health through Otago University, and they've been based in Ashburton Hospital. And so I went in and talked about 22q deletion syndrome, and they've sort of followed us for the year and caught in, seen how things were going. So that was really cool. When someone said to me, why are you doing it? I said, because one day those doctors are going to be in the emergency room or in peds, and they're going to be like, I learned about this one. Because who could learn the 7,000 rare disorders?
Yeah.
No one. But I'm like, well, at least I know that the 22q are going to have at least, I think it's about 14 doctors we've worked with now that are more aware about it. And it wasn't just that, it came down to the nitty-gritty of how do parents and caregivers want to be treated when they have a sick child and they are stressed and they're tired, and what can we do better to make that a smooth transaction, but a smooth time. And one of them still keeps in touch now, and it's really cool, and they love to see the progress with the kids. And I feel like that's really valuable. That's something valuable that the rare disorders community can give back to doctors that then can be given back to patients.
Yeah. I mean, for TSC, what we aim for, I guess, or what should be the minimum, I guess, is that as soon as a child or a person receives a diagnosis, the first thing their clinician does is tell them about TSC and Z, right? Yeah. What people are often told is do not Google the condition. We hear that all the time, right? And I understand why, because it is scary what you can find. But what they should be saying is Google or go to TSC NZ or go to Rare Disorders New Zealand. Is there a support group? Because getting that support straight away is so important.
Game changing.
So one of our challenges is how do we make sure that happens? How do we make sure that clinicians are doing that? They are passing on our information. And I don't know if we have the answer to that, apart from to work with other groups and Rare Disorders New Zealand. You know, as a collective,
yes,
we're stronger and we give each other strength. So,
and we're working really hard. Like I carry pamphlets in my bags every appointment we go to. I'm like, here's some Rare Disorders New Zealand pamphlets. Flick the team an email. If you're unsure, give it to the parent. And it's just, as we are the umbrella organisation for around 160 support groups in New Zealand, but also the team at Rare Disorders New Zealand will search for support groups if we don't have them on our books.
Yeah.
So it's, instead of trying to have 7,000 brochures where they have to give it out, it's having the information. But we were also told not to Google, but of course I did.
Yeah.
And thankfully I did, because there was a conference here 3 months later. So we went knowing that we had to skill ourselves up as much as we could. But again, not everyone's in that has the opportunity to do that.
Yeah.
And I think it is really important for doctors and nurses and social people, early intervention teachers, is to know where to go to get that information. Yeah. So we're slowly working on that. We're fastly working on that.
Yeah. And, you know, people who run support groups have a very, very close connection and understand what people are going through. So quite often, you know, when somebody or a child first gets a diagnosis, family isn't ready to talk to anybody else, and that's absolutely fine. You know, I think everybody who is involved with support groups appreciates that, and there's no expectation. Well, you must become a member of ours. No, you know, it's when you're ready. But know that support group is there for you to reach out at any time, and then disengage at any time, and then reach back out. You know, I feel like clinicians could have a better understanding of how that works. I feel like government could definitely have a better understanding of how that works, because I think ministries and government's understanding of what community groups are, who they are, and what they do is quite limited, actually.
Yeah.
And the sheer amount of support that they, you know, community groups are providing is vastly undervalued. And you know, sometimes, you know, sometimes it's just knowing that other people are there that understand. Sometimes it's having a chat. Sometimes it's, you know, sending an email. But some people it's, you know, really, really important. And
just knowing you're not alone.
Yes.
And you're not, especially at 3 o'clock in the morning and you're sitting there. That's when I do my best research. Is at 3 o'clock in the morning.
Yeah.
I'm determined I'm going to find the answers today. What excites you the most about the future for TSC research and rare disorder advocacy in New Zealand?
I mean, I think we're very lucky with TSC in that we understand, you know, the genetic causes of TSC, and we understand the pathway that's involved in the brain, which is by no means my area of expertise, but there are treatments available that target the pathway that's impacted by the gene. So we're lucky in a sense because of that, because we have a lot of understanding, but at the same time, we still struggle with this understanding how we can make people's lives easier and better. So I think I'm really excited that we've got the rare disorder strategy for a start, and I'm really excited that we've got a research network of people from really broad backgrounds of research and science, and that we can, you know, find ways to all work together. And many of those people have multiple roles. So some are clinicians and researchers, some work with community groups and researchers. So bringing everybody together in that way is really exciting. I know there's some stuff going on with European research groups as well that hopefully Chris is going to talk to at the community session that we're having for Rare Disorders Month. So yeah, seeing where that collaborative approach goes. We can't just have one group of researchers working together to discover new conditions or diagnose new conditions, and another group working to develop treatments and find a cure, and other, we need to all work together.
Coordinated care, coordinated research.
Yeah.
We've just solved it.
Yeah.
And how can our listeners get behind the work you're doing?
They can talk to people about it. They can. So at the moment, there is a web page on the Rare Disorders New Zealand website, and we also have a page on the Compass website, which is the research group I work for. So have a look. I guess just having a look and
do a Google.
Do a Google for my name, I guess, and Rare Disorders. Come to any of the events that we've got planned.
So the one they've got planned, is that going to be in Auckland during March, is it?
Yeah, so penciled in for the 23rd of March. So to coincide with Rare Disorders Month.
We've got Rare Beer on the 20th of March.
Yeah.
It'll be a good week
forward to that.
I'm going to see you there.
I was a judge last year and it was fantastic. And now it's in Auckland. So.
And I did it the year before.
Oh, did you?
Yes.
I know a lot of brewers.
Yeah.
A lot of them. So,
that's so cool.
So yeah, that event, we're going to get together different researchers, have them just talking about the research they do, and then just have a discussion, a panel discussion about what can we be doing. It's not going to solve everything. It's not going to be a massive conference. And then we're planning the TSC conference in Christchurch in October. So anybody with TSC, I would say if there's anybody listening who has a connection to TSC to
share that information.
Check if you're on our mailing list, and if you're not on our mailing list, sign up. Without us knowing, who people are, we can't kind of get information out there. So,
like you said before, you can join a mailing list. You can interact if you want to. You can come back when you need support. But knowing that you have a community out there is the biggest thing going forward with living with a rare disorder in New Zealand.
And our mailing list is fairly low key. I think we do 3 or 4 newsletters a year. We've got our Facebook page that we use. So we've got our secretary Tom mailing deals with all our social medias. It's not something. Apparently, I should get into TikTok, is what I've been told.
Yeah, no. Well, thank you so much, Lisa, for your time today. I have learned a lot about you, and I really look forward to sitting down with you in March at 16 time on the 20th of March, and then also looking forward to that week hearing of how your research event goes. I know there's a lot of conversation around people wanting to come to it, so
awesome.
I'm very excited for you.
Cheers to that.
Cool. Thanks, Lisa.